You mentioned, family constellation therapy and work there, Hellinger's work with that. We've seen wonderful things when patients go through that, but it's
Huge.
often very, very misunderstood. And if you're looking at it from an objective point of what type of, medical procedure is this, because it's not a medical procedure, of course, they dismiss it many times as well. This isn't
Huge.
helpful. What is the drug? Yeah, talk a little bit about why it's so important that type of work.
Well, human beings who sit in front of you, they are half their mother and half their father. So
Hmm.
50% of them comes from mother lineage, and more importantly, the mitochondria come from mother, 50% from father. And whatever the father or mother could download into the child becomes the grist for the mill and becomes the narrative and story that child then carries throughout their life. And sometimes the child didn't get much from mother or father, and then they judge mother or father accordingly, and they have a block to the energetic transfer of order in the system that comes from the parents. And then sometimes that parent didn't get much from their parents, so you have this whole lineage of mothers and fathers who weren't seen, weren't heard, and got very little from the parental influence, and the whole system gets entangled into this resentment and judgment and I hate my father. I hate my mother. I don't speak to my brother. That system is blocked. There's no way that the life force can come through that system. And unless you have a methodology of unblocking it and showing them insight, you're not going to get, because, Dietrich was great with this. He's, the upper levels trickle down to the lower levels, but you can't treat the mold and then fix your family system. So once you start seeing how the person can release their life force and accept the parental influences and say yes to mother or father, you can't really access the whole energetics of your inherited ancestral life force, which is vital to vitality and resilience and ability to negotiate the slings and arrows of life, and your illness.
Right.
You need to tap into mother and father's energy. They stand behind you and say yes. I watched Hellinger work once in Washington by surprise. I didn't even know who he was. I went into a hotel room and he had 300 people there. It was at a conference. I just happened to stumble, and there was a woman with breast cancer, and she sat down, and he looked at her, and she started laughing, and he told her to go sit down. He said, "I'm not going to work with you," and she had stage 4 breast cancer. And he just said to this woman, because he found out later that she hated her mother and hated her father. And he said, unless you can say yes to your mother and father, I'm not working with you. You don't take this work seriously. Now, people will get all up, they get, well, my father did this to me and my mother didn't do this. And my mother was a narcissist and an alcoholic. Okay. Family constellation practitioners work through those dynamics and show an individual how that system, in spite of it being tiny and only the patient getting a thin thread, that still led to you got life from your mother. You exist because of your transmission of sperm and ova. If unless you say yes and be grateful for life itself, I cannot help you.
Hmm.
And that
Incredibly powerful, right?
can unlock the floodgates. People heal when they get that kind of insight.
And let me ask you, what percentage of patients require possibly not even, family constellation, but emotional or traumatic type, resolution therapies?
In my experience, the majority of complex illness require family systems insight and amygdala retraining and
Hmm.
somatic experiencing, even psychedelic therapies to bypass some of the default mode network and the narrow. One of the things you don't heal in the same environment you got sick at, you don't heal with the same mental field that you originated your illness, and you definitely don't heal with the same story that you're telling your narrative, your internal dialogue with the 60,000 thoughts a day. You don't heal with the same narrative unless you have a sort of some breakthrough experience. That's why psychedelics have become so sort of revolutionary, because people they can break through their insights and bypass their internal dialogue by having a transcendental experience through psychedelics. But you
Are
can do
you are you a
that.
fan of
What's that?
psychedelics? Are
Was
you a
that?
fan of psychedelics and
Uh,
use of MDMA
well,
and others? Yeah.
anything that helps a person develop a new narrative, a new mental field, a new
Yep.
insight, which then releases energy for lower for mitochondrial energy transfer. Absolutely.
Yep.
Why say no to anything that helps, you know? I have patients who only want natural treatments for mast cell. They don't want drugs. Why don't you want drugs? Because I think they are unnatural. Well, I can tell you now, mast cell blockers work 10 times more than quercetin does. Okay, you don't want to do levocetirizine? Do quercetin. Might take a bit longer or not. Sometimes people with that belief, they do well with quercetin. You've got to work with all layers, all levels, all beliefs, and do your best to bring your certainty to the equation without hubris or arrogance. I'm the doctor, do what I say or get out of my office.
Well, that's the thing. It's a relationship. It's not. I think too many people see their doctor as this savior or is going to do the healing for them, right?
The
Especially as we
hero
know,
archetype. Yeah, we occupy the hero archetype. I'm all
right?
knowing, you're all ignorant, do what I say, or that's a one-sided nonsense relationship. Yeah.
And again, but that's what most of conventional medicine is, right? You have a few minutes, they write up on a piece of paper and say, do this and do that, and don't worry about this or your lifestyle, and keep seeing me year after year as you get worse.
And at times that is an appropriate intervention. I recently had open heart surgery because of an aneurysm, and my surgeon, I don't want him to know about integrative healing and levels of that. Just fix my valve. Thank you. I'm quite happy with that.
It's necessary still, right? People
Oh
think
yeah,
I'm against it. My father started off conventionally based and
no
was
problem
doing
with
those
it.
surgeries and anesthesia on people, so I know it's still necessary.
Please keep doing it. I'm very grateful. That saved my life. Yeah, I don't want you to know about shamans and psychedelics. Just operate on my heart valve. Thanks. I'm very grateful.
There's a place and time for all different facets of what is already out there in medicine, correct? It's just when
Absolutely.
you look at it from the complexity of most chronic diseases that are around today, conventional medicine does not have the best solutions. As you said, the surgery will not help for those things that require emotional work.
Absolutely. And the other some patients also come and say, um, won't you educate my specialist or my GP on the work that you're doing with me? I say, absolutely not. That's not the no. They are
Yeah,
good at what they do within that. You must learn when to take this complaint to them. Don't try and get them to cross over. That they're good at that. Use them for that. And don't try and convince them of integrative principles and 7 levels of healing.
right.
It's just a waste of time. They don't want to know about it. They just do what they do and they do it well and say yes to that, you know.
Right. Instead of trying to teach someone to learn a different language, let's appreciate there are many languages we won't know each other, but we can still all get along on this world with so many languages.